actually realize how dangerous can it be not to be vaccinated, especially these times with the new variants coming out. So, yep, nice and pleasure to meet you all.
Excellent. Thank you all for that. I apologize. I actually started the recording just a little bit late, but we did catch the tail end of what Omar was saying there. So just a quick recap, the Region 8 immunization program is very similar to what we've been implementing in Chicago for a long time in terms of producing and promoting education and awareness of communicable diseases, as well as providing immunizations to prevent against the transmission of those various health conditions. So we'll be conducting, as Dr. Zhang said, at the next meeting, we hope to be able to share a community assessment of the area, similar to the one that was conducted by this group in last year around this time. So so without further ado, we will move on to the next point in our agenda, which is going to be a presentation on the new CDC guidelines, as well as information about the Omicron variant. Well, I'm sorry, about new CDC guidelines, information about returning to school, and then also talking a little bit about COVID-19 and some of the longer effects that COVID-19 can be found to have. That part of the presentation will be led by Omar. All right, let me go ahead and share that with y'all. Okay, does everybody see the full screen for it on me? All right, okay. So this is just kind of the information about this we're going to be talking about was actually released almost a month ago by the CDC, but we haven't had a meeting since then to be able to discuss in further detail. So I'm going to go through some of the finer points of the new guidance, as well as the reasoning for behind it. So the rationale for the new guidance is basically that we're in a much stronger place, according to Greta Massetti. She's a PhD. And she mentioned that we're in a stronger place today as a nation with much more tools to protect ourselves against COVID-19, or at least protect ourselves from the more serious symptoms and side effects of COVID. Thanks to people being vaccinated, we're hearing a lot more cases where symptoms are very mild for people. Hospitalizations are way down. As you can see in the data that I attached from COVID-19 as of August 26th, the number of new cases is still there's still a decent number of them, but it's down about 10% from the week before this data was captured. And as you can see, our peak day in Chicago for new cases was on it was well recorded on January 1st, or New Year's Day 2022. Pardon me, I put a 23 in there. That's definitely not correct. It's 1/1/22. There were 6,963 new cases that day, compared with just 529 new cases when this data was captured by me when we were making the presentation just on the 26th. And the more important number really is not necessarily the number of new cases, but the number of hospitalizations that has resulted in people, there's a 22% drop from the last week in terms of hospitalizations, and only 1.2 people per 100,000 are now being admitted to the hospital. Again, this is kind of because of the high vaccination rates in this city. More treatments are now available too for COVID-19 for those who are sick and may be unvaccinated. There's more treatments that are now available as well to minimize the symptom severity. Keeping this in mind, we do now have a much better understanding of how to protect people from being exposed to the virus. Um, so this new guidance, according to the Greta study, it acknowledges that the pandemic is not over, but it also helps us move to a point where COVID-19 no longer severely disrupts our daily lives. And I think at this point, it's become kind of common knowledge that we're not going to eradicate COVID-19 entirely. However, all of the work that we've done in terms of vaccinations, boosters, quality masks, testing, improved ventilation systems in buildings, all of this is going to help us move to a point where COVID-19 doesn't cause serious disruptions in our lives. It'll be something that we kind of live with, similarly to the flu or the common flu that we have, and the vaccines and treatments that we have for that. So keeping that in mind, there's some updates to the quarantine and testing guidelines. So first off, for those who are still unvaccinated, prior to this, if you had not received your vaccine, you're still highly recommended by the CDC to quarantine for a period of time, usually like 10 days or so, if you were exposed to COVID. Nowadays, if you are currently exposed to COVID-19, they're not recommending a quarantine as long as you're testing negative. So the guidelines now state that you should wear a high quality mask for 10 days after the exposure, and then get tested 5 days after that exposure, just to make sure that you test negative. Testing for asymptomatic people without known exposures will no longer be recommended in most community settings. So that's doing away with a lot of like testing requirements that there were in place previously with COVID-19. Those who did not have COVID vaccinations and were working in kind of like public spaces were often required to submit to regular testing. Now they're saying that testing of folks without any sign of symptoms for COVID will not be recommended in most settings. So there won't be as many requirements for testing at this point. Isolation guidelines. So regardless of vaccination status, if you are exposed to COVID-19, you still should isolate from others. But back when we started with this pandemic, we were recommending a 2-week isolation period, pretty much. At this point, though, regardless of vaccination status, you still need to isolate if you have COVID. But the most infectious, now we know that the most infectious period is during the first 5 days of having the virus. So basically, if you do have COVID, and you're tested positive, you're not required to just stay at home and isolate in a room by yourself. You are able to move around and be in public just as long as you wear a high quality mask. And then after 5 days, if you're fever free without use of medication, your symptoms improving, you can end your isolation after that time. So basically, they're still recommending that you don't go around people without a mask. But if you do have a high quality mask and you need to go out for something, they're no longer requiring you to remain at home. And then on top of that, if you are symptom free after or fever free after 5 days, then you can end your isolation period after that. It does also say you isolate if you're feeling sick and you suspect you have COVID, but you don't have the test results yet. It is still recommended that you isolate from others, and in this case, isolation doesn't necessarily, we're not specifically stating that you need to remain locked in your room by yourself anymore. You just need to make sure that you follow the requirements of wearing a high quality mask around others. So if you test positive, even if you're sick, obviously you have to follow the isolation recommendations, which we have above, or a 5-day period of time. If you're sick but you test negative for COVID, then you can go ahead and end their isolation. This is to say that, it's likely that you do not have COVID if you get the negative test results. And then regardless, this is still important to note that regardless of when you end your isolation, you should still avoid being around people who are at high risk to get sick until at least day 11. So if there are people around you, that are immunocompromised or have a pre-existing health condition that may make them more vulnerable to severe COVID symptoms, then you should, it's still recommended that you avoid contact with those types of people until at least day 11. Looks like we had a hand raised. Caro?
Yeah, I have a question about not necessarily need an isolation. When I read this, you still need an isolation unless you must be around others at home and in public, right? So you are still needs to be isolated, correct? Wear a high quality mask when it's not, you can always go out and with masks. You need to be isolated, and you have to, in addition to the isolation, you need to wear high quality mask when you have to be close to the family members at home or in public, isn't that?
Yeah, that's correct, Carl. So yeah, they're still recommending an isolation period. But I think previously they were stricter with their guidelines for isolation. They were recommending obviously to avoid contact at all with people. In this case, now they're saying, if you should probably stay isolated in your room, but it's not necessary, or it's not a requirement at this point. If you must be around other people, then you should just wear a high quality mask. But yeah,
Another question is, for example, I had COVID recently and I was still positive on day 9. And in that case, we are accepting those people who are still antigen test, not PCR. And if antigen test is positive, people can still go out after 5 days and without any symptoms.
Did you say that after 5 days, people could still be symptomatic?
So after 5 days, people are asymptomatic and no fever, but antigen test is still positive. Do those people need to be isolated, or those people who still positive on the antigen test can go out? And isolation.
So according to this, according to the new guidelines here, it's saying that if after 5 days you are free of a fever or you never had any symptoms, or your symptoms have improved, that you can end your isolation after day 5. That's regardless of what your test result may show. So even if you're showing positive for COVID-19 on day 9, for example, if you don't have any symptoms, or if your symptoms have improved dramatically, you don't need to remain in isolation. However, they still recommend that you wear a mask around others, and especially avoid being around people who are likely to get very sick from COVID.
Okay, thank you.
Yeah, no problem. Okay, and then any other questions about that? About the guidelines or the revisions to them? All right, very well. I'm going to go on to the next slide, and I'm going to ask my colleague Maggie to fill you in on a little bit more information about the booster shots.
Thank you, Andrew. So you guys might know that the FDA and the CDC approved the use of the updated COVID-19 boosters that are specifically for the Omicron subvariants, BA.4 and BA.5. So these are new, well, they are not entirely new vaccines. They are a redesign of existing or whatever vaccines that we give out to people right now. We call them bivalent vaccines, meaning they have two formula, right? One is the original formula of existing COVID vaccines, and plus a new formula that targets Omicron subvariants. Currently, only Pfizer and Moderna are approved for and for Pfizer is for people who are 12 and older, and then for Moderna is 18 and older. Hopefully these booster shots will increase our antibody levels and protect us for longer for the upcoming fall or winter surge. So regardless of your age, regardless of how many doses you have received in the past, you can receive this updated booster shots, either Pfizer or Moderna 2 months before, like 2 months after your last dose. So if you got your last dose on June 7th, no, July 7th, then you could receive the updated booster today if they have it. So previously the second booster, the second booster is only for people who are 50 and older, but with this new booster shots, anyone can get it. As long as as long as your last dose is 2 months before, right? But if you're someone who just had COVID recently, you might want to wait for at least 3 months after your COVID test to get this updated booster to avoid the possibility of having problems such as heart problems. But you also don't want to have a very long gap between your infection and getting this new booster, because COVID is changing so fast, and having a long gap means that you have a higher odds of getting infected in the meantime, right? So one of the controversies of this new booster shots is that it was not tested in humans. It was only tested in mice. But the CDC and FDA still approved them because so that they could be available to the public as soon as possible. So which means, well, they are very similar to the flu vaccines that are introduced to the public every year. So the flu vaccine every year is different from the previous year. Scientists basically predict which strain of influenza is likely to be dominant in the in that year, and then they design the vaccine based on that prediction. So it's very similar to flu, and it makes sense for the FDA and the CDC to approve it because of the possibility of a fall or winter surge. So when we promote this vaccines to the public, we might have an even more difficult time trying to convince them to receive something that has not been tested on humans. But still, it makes sense to speed up these shots and for people to get them, because human trials take a long time. So Maha actually had a vaccination event this morning, and we were going to give the original second booster to our patients, but then CDPH said that they could no longer administer these old booster shots. They could only give out these new booster shots, but the problem is they haven't received these booster shots yet. So I guess once they do receive these new booster shots, they will only administer these new booster shots and just completely and not use the original COVID vaccines for booster, but they can still use it as a primary as a first and second dose, but not as booster. So yeah, so if we can Maha we try to have a vaccination event with the CDPH at once every month, just for COVID. So next time, if we can receive these new updated booster shots from the CDPH, we can hopefully we'll receive a lot because people have been asking for them. So once we do, we'll send out a flyer and send it out to, we'll create a flyer and send it out to everyone in the group so that you guys can help us promote this these booster shots, and also for you to, if you're interested, you can also come to Maha and we'll administer these shots to you.
Oh, great. Thank you very much, Maggie. Appreciate your help on this. All right, so we're gonna move on to the next part of our presentation. This is gonna be about kind of the longer effects of COVID and some really important information that we want to make sure is clarified for all of our members. Omar, you can go ahead and have the floor, sir.
Hello, everyone. This is Omar. I'm a clinical pharmacist with Maha working on the immunization program. We're going to have a small, brief presentation on how COVID can have an effect on the whole body, not just the lungs, because we need people to realize and understand that COVID was never just a lung disease. Next slide, please. So as we all know, the coronavirus is a virus that affects the lungs. It infects people of all ages in different ways. Some people get really sick and need hospitalization, but for others, it just feels like a flu. So how does that happen? In this presentation, I will be talking more about how COVID can make one person really sick and other people just feels like a flu. So what happens, COVID actually can reach other organs and systems in our body, such as the heart and the cardiovascular system, or the kidneys in the nephrological system. Next slide. I'm going to start off with cardiac abnormalities. When we say cardiac, we mean the cardiovascular system. We mean the heart. So I'm going to start off with the cardiac abnormalities that COVID patients had when they presented to the hospital. These are serious heart conditions that might cause, they might cause death if left untreated, such as myocardial infarction or the cardiac arrhythmias, or even heart failure. Now, these are the possible causes of the myocardial injury we're talking about. And I say possible here because there is still no definitive cause of how COVID actually hits the heart. We know it hits the heart hard, but we don't know how exactly does it do it. These might be pre-existing conditions such as the myocarditis or the coronary artery disease, but we don't know exactly if these conditions are the causes of COVID hitting harder with people on their hearts. Next slide, please. These are some important labs that were found to be abnormal in severe cases of COVID-19. Now, if COVID-19 was just a lung disease, we shouldn't see these elevations in these labs, such as the troponin test or the D-dimer test. A troponin test is a test that indicates that a person might have had a heart attack or is having a heart attack. And these tests are pretty dangerous. So if COVID was just a lung disease, we should never see any elevations in these tests. As a conclusion here, among patients who had COVID-19, it was found that the risk of cardiovascular disease may be increased due to the myocardial stress or the hypercoagulable state associated with COVID-19. So COVID-19 patients are at higher risk of cardiovascular disease, even when they're done with COVID or even when they test negative. Now we'll go to the nephrological abnormalities. When we say nephron or nephrological, we always mean kidneys, because a nephron is the main functional unit of the kidneys. Now, recent studies shows that 30% of hospitalized patients, COVID patients, developed what's called an acute kidney injury, which is a decline in kidney function. It's a serious decline in kidney function. It might be reversible, and it might actually turn into a chronic kidney disease. Now, as we all know, the kidneys are in charge of filtering the metabolic waste of our bodies. COVID has proven to have a negative effect on that filtration, which led to these metabolic wastes to build up in our blood. When we say metabolic waste, we mean these are like the creatinine or the blood urea nitrogen, and these if they build up in your blood, that's something dangerous. So the filtration here of the kidneys was affected in COVID-19 patients, especially the hospitalized ones. Some people suffering with severe cases of COVID-19 have shown signs of kidney damage, even if they didn't have that kidney problem before COVID. Now, how does that happen? How does COVID actually affect the kidney? So one way is that the coronavirus itself might infect and attach to the kidney cells. All of the cells have receptors that the coronavirus can attach to, and when they do that, it will damage the tissues of the kidneys and these cells. Another way is, we all know that COVID might cause low levels of oxygen, which means less oxygen reaches to the kidneys. And that will affect its functionality and its filtration for the metabolic waste we talked about. A third way is the immune system. The immune system might be fighting too hard. Releasing cytokines. Cytokines are small proteins that helps our body fight the coronavirus. Releasing too many cytokines might actually have a negative effect, because when the immune system is fighting too hard, then it won't recognize between healthy cells and infected cells, and that will affect the healthy cells of the kidneys, leading to a decrease in its functionality. And a fourth way, it was proven that COVID causes blood clots, which can block the bloodstream to the kidneys, and that will have a decrease in the functionality of the kidneys. So as a conclusion, people hospitalized with COVID-19 are at significant risk of acute kidney injury, and they're at significant risk of moving to dialysis and kidney replacement therapy, and even sometimes death. Now I'm gonna leave you with this small video on next slide from the American Heart Association on how COVID-19 actually impacts the whole body, not just the lungs.
This virus, when it first, as we were talking about at the beginning, as the numbers were shooting up in New York back in March, we thought we were dealing with a lung disease, right? And it turns out that it's much more than that, because the way that the virus gets into the cells of the body is by binding to this receptor called ACE2. It's an enzyme in the body. It's just that the virus has, through evolution, this virus arose in such a way that it recognizes this enzyme that we all have, binds to that, and then gets into our cells. And that enzyme, that protein, is located on cells in the lungs. So when we breathe it in, it gets into the lungs. But that same enzyme is present on the heart. It's present in the gastrointestinal system, the stomach and your intestines. It's also present in some of the nerve cells, which is why we see some neurological problems from it. But the really scary thing is that it's also located on the linings of the blood vessels that go throughout the body, okay, what we call the endothelium. So every one of your blood vessels is lined with these cells. It's like a skin within the blood vessel, and it's very important for regulating the function of the blood vessel. And this virus will bind to that enzyme on the surface of on the inside surface of the blood vessel and go into the lining there, and then it can set off blood clotting. And that's why we see clotting throughout the body from COVID. So it's not just a lung disease, it's just that it gets into the body through the lungs, causes lung problems. Some people, the lung problems don't even seem to be the major problem. It's when it gets into the blood vessels that it causes trouble.
And that's how serious COVID can be. Please let me know if you have any questions, and thank you for listening.
Hi, this is Ben. Thank you for the presentation. Can I ask one question?
Yes,
Oh,
sure.
of course.
I see that, from your presentation that, the negative impact on our body by COVID-19 is related to serious, syndrome. What about the mild syndrome? People nowadays, they just don't care, some of the people are even, get contracted multiple times, a few times, and they don't care. So to those people, what are your best advice to them? Are there any similar, negative impact on the body, like on the kidney?
So COVID, when COVID hits a person, it hits one person different than another. That's why some people will have mild effects and other will have very, very, severe effects. So for those people who had one time of mild COVID, I actually know someone who was hospitalized the second time, and the first time it was actually just a flu for him, and he actually didn't have any fever and nothing. But the second time, almost 6 months ago, or 6 months ago, yeah, it was 6 months ago, and it was, I think, a couple of months after he got COVID the first time, only 2 months after he got COVID the first time, he was actually hospitalized the second time. So if it hits you one time mild, it's not necessarily going to be mild the next time. So that's why we should get vaccinated, we should get boosted. And as the doctor said, all of the cells have this receptor, the ACE2. So maybe the first time what happened is the coronavirus didn't attach to these receptors on the kidneys or on the heart, but the second time it did, and it leads to like a decline in the functionality of these organs.
This is Ben again. Another question.
Mhm.
I myself got, the second boosters already, and I heard that there would be a new booster shot coming out. Is that the one that you mentioned earlier? Someone mentioned earlier, regarding the
Yes, a new
Yes, it
booster
is.
was just approved. Yeah.
Let me,
so should we get a fifth booster?
Yeah, and
The fifth shot. Yeah.
yeah, so anyone is this is not considered a fifth dose. It's more like an updated booster shot for people interested in receiving it. So literally anyone can receive this these booster dose, either a Moderna one or a Pfizer one, as long as your previous dose was 2 months ago.
there we go.
Right, because before, with the fourth dose or the second booster, only people who were 50 or older could receive it, right? But with
Yeah.
these updated booster shots, anyone could receive it as long as their last dose was 2 months ago. Does that answer your question, Ben?
Yes, yes. That means, even though I got the second booster, I can wait, for 2 months and then I get the updated one. Okay.
The updated one. Yeah.
Okay. Thanks.
Yeah. Thank you for your question.
Yeah, of course. All right. Any other questions about the COVID, the long effects on the rest of the body, or anything about the booster shots? Okay, very well. Well, so have just a little bit of time here to wrap things up. Like to open up the floor. I guess unless there's any other MAHA updates this time, open up the floor to announcements and updates from our AHEA members. But yes.
So yeah, I'll start. I just sent out a PDF, a flyer for our upcoming webinar about COVID and monkeypox. So this is going to be a Mandarin webinar because our host, Dr. Calvin Jiang, he speaks Mandarin, so it's going to be a Mandarin webinar. So if any of your clients who are interested and can understand Mandarin, please help us distribute this flyer to them. Or if you yourself are interested in learning some more about COVID and monkeypox, I think this will be a great opportunity. Yeah, it's gonna be September 15, Thursday from 7 to 8:30 p.m. Thank you.
All right, great. Thank you, Maggie. Yeah, and then please make sure to grab that the flyer that Maggie distributed in the chat, and you can help us promote this event so that we can reach more people. Any other announcements?
Yeah, I would like to go next. My name
Yes,
is Wen
please.
Yan. Yeah, from CPCAC, we're gonna have for the tomorrow, we're gonna have our open house event. It's gonna be 2 p.m. to 5 p.m. And this event is for our new office. Our location is 311 West 23rd Street. So feel free to come by. We have the games and the giveaways and goodie bags. And also you can talk to our staff members. Yeah, thank you so much, Andrew.
Yeah, no, thank you. That's wonderful news, Winyan. Thanks for sharing that with us. So if anybody's available, oh, great, I see the open house is being shared as well there too. So thank you very much for sharing that. And congratulations once again on your new building. That's wonderful news.
Thank you.
Okay, anybody else have any announcements?
Yes, this is Ben with the museum, with the Chinese American Museum of Chicago again. This coming Saturday, our museum has 2 events. One is called the poetry session with Chicago Poetry Center. The time is from 12 p.m. to 1 p.m. It's a free session. And let me paste the link. I think, is it the link for the registration for this event? And then in the afternoon from 5 to 7, we are going to have our Mid-Autumn Festival celebration at Set in Stone Gathering Space in collaboration with the Chicago Park District, the Film Museum, the Nature Conservancy, as well as CBCAC. So all these events are free. Please join us this Saturday for these 2 events.
Great. Thank you so much, Ben. Appreciate you sharing that information with us. Sounds awesome. Make sure if you are going to, or if you're interested in participating, follow the link that Ben provided in the chat to sign up. Dr. Zhang.
Hey, I want to thank everybody to submit your reports. Yeah, keep doing the good work, great work. I like make a little request of next time when you submit the report, save all the, if you have flyers or supporting documents to send along with your report, we like to like a funder know the activities, the actions that happened in the community around our network.
Yeah, we don't need every single promotional material that you
Right,
guys
exactly.
created during that quarter. So for example, if you guys had hosted a webinar about COVID-19, you guys made a flyer about that, we would like to receive that flyer so that we could show the CDC Foundation that, hey, we've got this great organization doing work to, increase to combat vaccine hesitancy or whatever. So we would like to receive those promotional materials if you guys have any.
Yep, absolutely. Okay. Are there any other announcements from our members here? Okay, no problem. Well, yeah, one completely unrelated to COVID-19, but the Chicago Sky are playing Game 5 of the semifinals of the WNBA tomorrow. I suggest you all show up and show out and cheer on our WNBA basketball team. They're going for their second championship in a row. This would be the first time that any Chicago sports team has won back-to-back championships since the 1990s Chicago Bulls, and you all remember those people, I'm sure, as long as you're as old as I am. Anyway, that was my little final announcement. Thank you so much to everybody who participated. We can give you guys back about 9 minutes of your Wednesday afternoon today. Again, special thanks to everyone. The recording for this webinar, or I'm sorry, for this meeting will be posted on our YouTube page. We can send out a link to you once it's been processed and set up. Thanks again to everyone, and you have a wonderful weekend, okay? Take care, everyone.
Thank you. Bye-bye. See you next time.
Thank you.
Thank you all.
Bye.